Greetings from Indian Medical Association and Heart Care Foundation of India. I am Dr. K.K. Agarwal, National President. Welcome to our series of discussions on every Friday on low-cost Medicare. When I say low-cost Medicare, we mean that how to take care of people with a particular disease, with all segments of the society, without compromising in quality and safety. And with me to interact is Dr. N.V. Kamath, who is the former Director of Health Services, Government of Delhi, and currently the Principal Advisor to NIMA. And the subject we are going to discuss in the next 25-30 minutes will be hypertension.
Yeah, the high blood pressure has become one of the very important disease in all categories, whether it is urban or rural, whether rich or poor. So everybody, most of the patients, they want to have, because it's a lifetime treatment. So they would like to know what is the way that where they can reduce the money which they spend on the treatment of their hypertension.
So first of all is, there are two types of blood pressure. One which requires treatment, and the second which can be managed without treatment initially. So the first of all, the most important thing is that at what time you should check the first blood pressure. And the answer is at 4 years of age. Unfortunately, nobody checks. It should be compulsory to have checkup of the blood pressure done at the time of admission to the school.
Okay.
If you do that, you will be able to prevent so many kidney failure in future. You will be able to diagnose secondary hypertension right at the time of diagnosis. So the first is that every school must make it compulsory to check blood pressure at the age 5. Second is between 5 and 20 and 50 plus. If for the first time blood pressure is diagnosed before the age of 20 or after the age of 50, you need to investigate. Now, if you can do these three things, which is not happening in the society, so anybody who has blood pressure less than 20, needs to be investigated. And second is that if anybody has a high blood pressure after the age of 50, he needs investigation. Between 20 and 50, so therefore we have different segments now. So a person who develops blood pressure before the age of 20, will be around 2% or 3% of the hypertension. They need investigations, don't deal with them, refer them to a specialist, refer them to a medical college, refer them to so if the person can afford private, can't afford medical college. Let them get treated, because in a private sector you are wasting your money, because so many tests are required. So it is always better to refer these cases to medical colleges of your area. They are also looking for, because all students who wants to study, they are also looking for such patients. So anybody who develops blood pressure between the age of 5 and 20, refer them to a medical college if you really want a good low-cost Medicare.
We call it as a secondary
hypertension. 50 plus, again, they need to be investigated, because this may be atherosclerotic, may be renal artery stenosis.
They may be primary or secondary.
But most primary will occur between 20 and 50. Any hypertension, which is the most common, 95% are between the age of 20 and 50. These hypertension can be managed if diagnosed early on lifestyle management. So the low-cost medical care of hypertension means multiple counseling sessions, change of lifestyle, and to find out what is causing their high blood pressure, what is precipitating their high blood pressure. So therefore, if you want to reduce, so first of all, identify them early. Blood pressure checking costs nothing. So therefore, the policy should be, a GP's policy should be, that anybody who has come after the age of 20, every time he comes, check your blood pressure. That should be complimentary. Not only of the patient, relations also. So if you check blood pressure, of mass screening of blood pressure, you may be able to get early cases of blood pressure, and you should be able to offer them lifestyle management. So therefore, lifestyle management will be cheaper to patient in long run. You will still get your counseling money. No, sorry for the interruption. There was some emergency at IMA and I had to intervene in between. So then let's come back to if a person has.
So you were talking that there are two types of hypertension. One is primary hypertension.
Secondary hypertension.
And second is
Let's talk about primary hypertension,
Yes.
investigate them.
Yes.
If the person can't afford, refer them to a medical college.
Secondary.
Secondary hypertension. Now when it comes to primary hypertension, that's something which is 95% and which should be handled by the GP or a physician. And that's his bread and butter. Now there, at the earliest, when a patient comes to you, you need to identify three things. First, you need to identify, has the organ been damaged or not? So is there a damage to the heart? Is there a damage to the kidney? Is there a damage to the nerve? Is there a damage to the eye?
No, but when do we call it the hypertension?
Any blood pressure, high blood pressure which is more than 20, less than 50, and if on a continuous more than 2 times you are getting it more than 120/80. If your blood pressure reading is more than 120/80, I am not talking about ambulatory blood pressure monitoring, I am simply talking about a blood pressure of more than 120/80. It means that patient has a hypertension, and if it is less than 140/90, that means you have caught him early. So between 120 and 80 and less than 140/90, you have caught him early, you have enough time to change his lifestyle to reverse it. But if it is more than 140/90, you need treatment. Okay, so there will be a segment of blood pressure between 120/80 and 140/90. Let's define that segment. And that segment, you only need the lifestyle management.
It may be reversible.
It may be reversible because this is a lifestyle blood pressure. Now here the first thing to measure is, and with that, you check for target organ damage and associated risk factors. Okay. Now if you have blood pressure of 120/80, with that now you look for associated risk factor. The first thing to check is abdominal circumference. His abdominal circumference is more than 80 in female, more than 90 in male. It means that the patient has metabolic syndrome. For a person as a rural area or a GP level, no further testing is required. No further testing is required with that. Abdominal circumference is more than 80 or 90. Just presume it to be a insulin resistance. His fasting sugar will be slightly on the higher side. His TG may be on the higher side. HDL may be on the lower side. If they can afford, get it done. If they can't afford, presume it and put them into a carb restriction lifestyle. Give them carbohydrate restriction, no chini, no chawal, no maida. And with that, you will be able to find out that the blood pressure starts regressing. So the first thing is abdominal circumference. Second thing is look their build. If they are absolutely thin build, then they may not be sodium responsive. Then sodium may not make a difference to them. But if they are middle build or a heavy build, then their sodium restriction needs to be done. How do I check? Give them a salt-free diet for a few days and check whether their blood pressure is coming down or not. So you can find out whether they are salt sensitive or not. So if you find a person to be salt sensitive, then salt needs to be restricted. By restricting salt, restricting carbohydrate, and replace carbohydrate with fruits and vegetables, you may be able to control a large number of them. Of course, exercise is important, no smoking is important, all these things are important. So the most important thing is salt restriction and carbohydrate restriction if the abdominal circumference is on the higher side. With this, you require multiple counseling sessions. So it's not necessary for you to prescribe, even these are prescriptions. So you get your money as a counseling, patient saves money on the drugs, and you are able to control. Provided there is no organ damage. Provided there is no organ damage, and the test for organ damage is only one. Check for urine albumin, 1 rupee. If albumin is positive, then patient already has a nephropathy. If albumin is negative, do microalbumin. Strip cost is 80 rupees. And if microalbumin is positive, he has target organ damage. His eyes are involved, his heart is involved, his kidney is involved. So the first two involvement will be endothelial dysfunction. If you say, yes, I still have a person who can't even afford 80 rupees, or you don't want to, ideally, microalbumin has to be done because there will be camps occurring once in 3 months. Book those patients into those camps. Otherwise, what you do is take a hand and press the brachial artery. So, when I press the brachial artery, what will happen? The blood flow will become zero. Okay. Now, in the limb you will get ischemia.
Yes.
If I press it for 2 minutes, what will happen? Ischemia. When I release it, what will happen?
There will be flushing.
There will be flushing. Arm will feel warmth. Okay. That flushing indicates that my endothelium is elasticity is normal.
Okay.
First to go in hypertension will be loss of elasticity. So this is an indirect way of checking it out. This is the indirect way of checking it out. So if you can find, it will be the warmth feeling which will come. So this also you can find out whether there is if there is endothelial dysfunction or there is a loss of elasticity, you presume some organ somewhere organ damage is there. And if there is an organ damage, then drugs should be started, especially the ACE inhibitors or AR blockers. So whenever you find, normally we say that nowadays they're saying is that no need for starting drugs, but if there is a target organ damage, even if the blood pressure is normal, that normal is not normal for him, you may have to put him on some drugs. So otherwise, all these patients can be managed comfortably for 6 months, 1 year, 2 years, 3 years, maybe permanently without medication. So this is low cost Medicare.
Then there is also a role of their workplace stress or stress at home.
Stress is the reaction of the body and the mind to the interpretation of a known situation. So either you change the situation or you change your interpretation. So they need interpersonal counseling. They need cognitive behavior counseling. They need to understand what are their stressors. Now there is a simple way a doctor can find out the stressor. The stressor is you make a list of 50 items. You're watching cricket, watching football, walking hockey, eating, going out, talking to friends. Write down 50 items. Then ask the person to tick mark. Give marks from everything out of 10. So he says watching cricket 9 out of 10. Walking football 2 out of 10. Okay, so whenever you want to relax, watch cricket, don't watch hockey. He says eating paratha is 9 out of 10. Eating puri is 5 out of 10. So whenever he is stressed out, then he should eat paratha. So whenever you are stressed out, you should have a list of pleasurable items, not you, your wife, your partner or your children or your servant should know, so that they know what to offer. So if suppose you don't like coffee, and if you are stressed out, and somebody gives you a coffee, you will say, hey, I don't want. So stressors needs to be identified, because every time there is a stress, blood pressure shoots up, and that's dangerous. Up and down, up and down, up and down is dangerous.
So that means the most of the cases with hypertension, the primary hypertension, can be treated without.
A large number of them should be treated with lifestyle management
For a long time.
for a long time. Now the second drug which comes with the first drug of hypertension is metformin.
Okay.
So if the majority of them will have a pot belly obesity,
Okay.
you give them metformin, metformin will take care of insulin resistance, BP will come down. So people think metformin is for diabetes, but metformin can also be for metabolic syndrome. So if they have associated metabolic syndrome, if their fasting insulin levels are high, if you give them metformin, it will help reducing the pot belly, it will help reducing the insulin resistance, and their borderline hypertension will become
Even
normal.
if the blood sugar is normal?
Yes, I'm not talking about diabetic at all.
Okay.
These people will have, instead of 80, their fasting sugar will be 90.
Okay.
Their fasting sugar will not be 60. So their fasting sugar will be 85, 89, 90, 95, still not pre-diabetic. So these are the people, so therefore
insulin level should be higher.
insulin level will always be higher If the abdominal circumference is high, don't waste money on insulin resistance.
Okay.
You can clinically give them metformin, try them for 2 months, 3 months, see the level of abdominal circumference. If the abdominal circumference reduces, your diagnosis is confirmed. So therefore, metformin is also an antihypertensive medicine in such cases. But if you find there is a target organ damage, or if you find that blood pressure is still high, or if it is crossing 140 by 90, then you need to give a drug. Okay. Drugs, choose NLEM from the National List of Essential Medicines. Choose a drug from NLEM, not NLEM. From National List of Essential Medicines, choose a drug, say beta blocker, atenolol. Okay? If the person can afford, then you have labetalol, you have labetalol. But for a person who can't afford, which 80% of the people will be, give them atenolol. Okay? If you want to give 25 milligram, prescribe 50, he can cut it by half, he saves money. If you want to give a metoprolol, succinate, nebivolol are for rich people. Atenolol is as good. In calcium channel blocker, amlodipine. All others are costly. So amlodipine 2.5, 5 milligram, 7.5 milligram, 10 milligram is fine, costing less than ₹1. If you want ACE inhibitor, enalapril is as good as ramipril. Okay, cost less than ₹1. If you want to give a AR blocker, losartan is as good as azilsartan. Losartan also is a neuroprotective. Only thing is losartan has to be given twice a day. A poor man doesn't mind eating them twice a day with that. So,
but how do you select which is the drug which is suitable for?
Okay, so there is a formula for that. The formula is blood pressure is equal to heart rate into peripheral resistance into stroke volume. So you will now depend to, you need to calculate this blood pressure is due to what? So a person says my blood pressure increases with anxiety, that means his heart rate increases, stroke volume increases, beta blocker has to be given. So if a patient has a pulse rate of 80, 85, 90, normal should be 60, you prefer a beta blocker. Okay? Take care of the precipitation of a diabetes. If you find a person is slightly obese, he has tendency for water retention, in that case, the best drug will be ACE inhibitor or AR blocker. So ACE inhibitor or AR blocker. If you say this patient may have associated coronary artery disease, or I need to combine with a beta blocker, then give amlodipine. So this is how you can choose. And all these drugs are costing less than 100 rupees a month. Total treatment will be less than 100 rupees a month for a low cost Medicare. Similar medicines are available if the person can afford, you can choose whatever you want. You have an option available. But don't refuse a person who can't afford more than 100 rupees by saying, I can't treat you. He can effectively be treated even within 100 rupees per month medicine. Diuretics, I normally would say restrict to it. I normally, but otherwise hydrochlorothiazide, chlorothalidone, both are available. Half the dose you can monitor these patients and put them on.
It will not be the first line of treatment.
You can, if you want. See, a person who is requiring only hydrochlorothiazide as a treatment, very well be without drugs. You can, so if the blood pressure is more than 140/90, alone hydrochlorothiazide alone will not suffice.
No, it will be addition to the atenolol.
Yes. Yes. All these combinations are costly. You can use them person who can afford, but for poor people don't use combinations. They are costly. So if I have to use for a low cost medical care of hypertension, losartan, amlodipine, and enalapril are my 3 drugs of choices for these cases. And diet management and other management. If the patient has atherosclerosis or high cholesterol, then I need to give atorvastatin. Okay. In hypertension, plus minus, without target organ damage, should I give aspirin or not is controversial. So if there is no target organ damage, risk factor management and minimum drugs, you should be able to manage. So minimum investigations, minimum treatment you will be able to. But if a person can afford, yes, microalbumin, lipid profile, then you can go to insulin levels, you can go to HbA1c, you can go to thyroid profile, you can go to PSA profile, you can go to color Doppler echo, stress thallium, you can go to renal artery scan. all these things are, sky is the limit for investigations for that. Sky is the limit. But then we also need to find out adequate evidence-based treatment to a person who cannot afford more than 100 rupees per month, which is as good. There will be hardly any difference as far as the management is concerned.
But some of the cases who are having hypertension, they also may be having diabetes. So
Most of the people who have diabetes, that will be hyperinsulinemia leading to diabetes. In such cases, hypertension will come first. They will develop metabolic syndrome, then the sugar starts rising in them.
So
Both of them can be managed with lifestyle. But if you are in an advanced case, then you need to put on anti-diabetic treatment also.
yeah, we need to investigate them for the blood sugar.
Only thing, blood sugar in every case. You have to do a urine examination for urine sugar, get a fasting sugar done. No other test is required. If the fasting sugar is less than 100, no HbA1c is required.
Okay, yes.
So all cases of hypertension associated risk factors, lipids, sugar, smoking, needs to be checked out. But they don't have to be done every month.
Yeah.
If a person suppose can't afford, don't waste his 800 rupees on lipid profile. Put him on lifestyle management, then get it done. And then most of the, for such people, camps do take place once in 6 months, once in 3 months.
Yes, this is regarding the primary hypertension. So what about the...
In secondary hypertension, refer. Because you require a renal scan, you require a renal artery Doppler, you require intima media thickness, you require so many urine tests for children. It's always better to refer. 5% patients you can refer, 95% you can manage. Don't make, because whenever you investigate secondary hypertension, wherever you go, you will re-investigate. Send them primarily to a person who can investigate.
So that means that in primary hypertension, you have almost reduced the level of investigation for the poor patients.
Yes.
Where
If you are rich, you can afford, go to the private sector, let them investigate you.
Yes.
They will check they will do lot coarctation, they will look at your hormonal profile, pheochromocytoma, all these diseases they will like to investigate, let them investigate it. But it may be better if you can't afford, go to a medical college. They will give you a VIP care, because primary they are looking for. Secondary they are not interested in the medical college. So look after secondary, refer the primary.
When do we suspect that, or the patient himself, he has to suspect that whether he is having blood pressure or not? Most of them,
Blood pressure is a silent disease.
Yeah,
Get it investigated. Every time you go to a doctor, get your blood pressure checked. You can do a home monitoring. Yes, home monitoring of blood pressure is feasible. You can do ambulatory blood pressure monitoring. It can tell you white coat hypertension, that you're stress induced, you go to a doctor, blood pressure rises. It can be a masked hypertension, that in the doctor's clinic it is normal, but in the outside the doctor's clinic it is high. So all these cases can be checked out with ambulatory blood pressure monitoring, but that's a stress-related disorder. So if you have an executive, get it done. But for poor people, we still follow, every time they come, check for blood pressure. Someday you'll find the blood pressure is high and take precautions. But yes, if a person is affording, there we should also get once in a year ambulatory blood pressure monitoring to check for night dip, to check for his renal variation in blood pressure, masked hypertension, and controlled, uncontrolled, difference between systolic at different timings, pulse pressure, all these things needs to be needed in such cases. But again, they will be less than 5%.
yes. So that means what you want to say that the hypertension can remain in the patients without any symptoms for a long time.
Even up to 10 years.
Yes, and everyone between the age of 20 and 50, they need to get regular blood pressure checkup done. And even in the children at the age of 4 or 5, or second time before the age of 20, they need to be...
Anybody who has blood pressure at age 5 needs to be referred, and if you detect blood pressure between the age of 5 and 20, that means in school age, it is always better to refer to a specialist, let it not be looked after by a GP. And if the blood pressure is being detected after the age of, if the blood pressure is being detected, and if the blood pressure is being detected after the age of, इसको hold कर लेना, phone पे बात करते रहना. And if it is being detected after the age of 50, get it investigated. It may not be atherosclerotic.
What is the role of ECG?
ECG, yes, if you are looking for, in some cases you may be able to detect left ventricular hypertrophy, otherwise it has no role. Echo, yes, LVH, diastolic function, but all this may not be required if the person cannot afford, but if the person can afford, yes. When you are looking for target organ damage, you need kidney scan, you need kidney test, you need heart test, you need stress echo, thallium, intima media thickness, ankle brachial index. Another test you can do is a simple ankle brachial index and check whether there is a peripheral vascular disease or not. You can also feel the hardness of the artery, all these things you can feel. So the whole idea today was that it is possible to treat, never deny a patient with hypertension that you can't afford. The whole discussion today was that even in 100 rupees per month, you can manage a patient with high blood pressure. So we will continue our discussions next time with some other subject. In the meantime, let me see if there are a couple of questions quickly. How often one needs to investigate a hypertensive if it is normal, less than 3 years? How to get low-cost healthcare in hypertension being Indian? Yes, what we have discussed today. How much beneficial are these health checkups? No, health checkups, I don't agree with the annual health checkup. If your cholesterol is high, once in 5 years. If your sugar is high, once in 3 years. Otherwise, it is not needed. So let's come back next week. Let's thank Dr. Kamath for interacting with me. And we will come back next Thursday with one more topic next time on low-cost Medicare. Thank you.